The stress of college can create real mental health concerns for students.
One South Carolina couple says that it all became too much for their son, a student at Clemson. They told Channel 9's Allison Lottis that they want their heartache to help others.
This is one of my favorite pictures of Jacob.
Jacob Eyring's parents were proud to tell me the story behind every picture.
He could take something that wasn't working and make something really neat out of it.
But there's a part of Jacob pictures never captured. He lived with mental health issues, diagnosed with bipolar disorder at age 6. His parents say that didn't hold him back. In 2015, he proudly began his sophomore year as a Clemson Tiger, but soon reached out to the university for mental health help.
I thought they had a psychiatrist there with all the touting about their psychological services and medical services. But he wasn't being seen by a psychiatrist. He was being seen by a general practitioner.
His parents say in a month's time, Jacob was prescribed several antidepressants. On October 13, 2015, they heard from him for the last time.
A very sad text message saying that he didn't want to be a burden anymore and that he would watch over our family.
Jacob died by suicide.
It could have been prevented.
The Eyrings are now suing Clemson University.
At the time of Jacob Eyring's visit to the Redfern Health Center, there was not a psychiatrist on staff.
The family's attorney, Rick Hall, says Jacob told Clemson's doctor about his bipolar diagnosis. He claims the school was negligent in treating Jacob and failed to properly follow up.
We don't think that a family doctor should be experimenting with a patient's life where they carry such a serious diagnosis as bipolar disorder.
Clemson would not comment on the lawsuit, but sent me a statement saying, in part, Clemson's emphasis on mental health and suicide prevention is robust, and the Tigers Together Suicide Prevention Initiative began a number of years ago with a focus on creating awareness of the resources available.
I wanted to know if our local colleges are seeing an increase in students with mental health needs and how they're handling it. Here at UNC Charlotte, psychologists, social workers, and counselors have seen a 22% increase in student patients since 2016.
This year, Wingate University added an extra full-time staff member because of the rise in students seeking mental health care. Johnson C. Smith University told me cases have doubled in the past year. They attribute the rise to more awareness on campus. Since 2016, more than 500 Winthrop University students have sought counseling services each year. Officials say adding staff would impact tuition and fees, so now interns support the existing staff. The Eyrings believe Jacob's bipolar disorder and the medications Clemson's doctor prescribed created a dangerous and ultimately deadly combination.
We want justice for kids that are in school right now that may be dealing with the same kind of issues that Jacob dealt with.
That mission and the happy memories of when Jacob was here are what they hold on to now.
I miss him so much, we do.
Clemson University successfully argued for a mistrial in the Eyring civil lawsuit this month, but their attorney tells me they expect to be back in court on the case in March.